Thank you, and grateful to be part of GIS this year. I have no disclosure related to this presentation. I'll talk about the clinical overview of the renal denervation, and I will share with you my experience with the various renal denervation techniques. So we know the relationship and the crosstalk between brain and kidney, and the sympathetic nervous system between brain and kidney, stimulating the vascular tone and cardiac function just to increase the blood pressure. And the renal denervation rule, it cuts and interfere with this relationship just to decrease the blood pressure. Anatomically, the sympathetic nervous system, renal nerves, is arising from the proximal ganglia near the aorta, and it's surrounded, as you can see here, the main renal artery as well as the branches. And this holds a significance in the technique and clinically, as I will mention later. We have three methods of renal denervation. Forget now about the alcohol because it's not approved yet and still under investigation. So we have three main methods for renal denervation. We have the radio frequency and ultrasound energies just to heat and destroy the nerve endings. And the good news that both are FDA approved. The radio frequency technique that's available now in the market, it's called the spiral catheter. It's simply a catheter, as you can see here, with 4 electrodes. It's 6 French compatible. It needs 60-second simultaneous ablation. We ablate any vessel diameter between 3 to 8 millimeter. And the important point here in the RF technique, we need to ablate the main as well as the branches. So the target in the RF devices that we ablate the main as well as any extraparenchymal branches between 3 to 8 millimeter in diameter. So here is the technique or the procedure. Just after we get the femoral axis, we go with the aortography just to check the anatomy. And if there is any accessory renal artery, we go ahead and ablate it. And we also do some measurements in the fluoroscopy just to be sure about the measurements and get the vessels we need to ablate. Then we go with the selective renal angiography. We make sure we don't have renal stenosis, no fibromuscular dysplasia, no renal artery aneurysm, because this is the main contraindication for both kidneys. That's followed by introducing the catheter. As you can see here, this is one of my cases. I do it live. And you can see here the catheter is straight because the wire is straightened, but once we are taking out the wire or we pull out the wire, the catheter, it takes its shape, the spiral and helical shape, as you can see here, ready for the ablation. We perform the ablation using, there is a remote control connected to the generator. It has 4 buttons, as you can see here. Each one corresponds to 1 electrode, and we can easily select and deselect any of these buttons just to give the energy at the site we need. Moving now to the Paradise system for room recall. It's the ultrasound renal denervation system available now in the market. It's simply a balloon connected to a generator. It's 7 French compatible system. It needs only 7-second ablation time for each cycle. It ablates a vessel diameter again between 3 and 8 millimeter. But here we only ablate the main renal artery. We don't need to go for the branches for the ultrasound devices. And this is how the ablation by ultrasound, as you can see here, it's complete 360-degree, complete circular, and it's a bit deeper in ablation than the radiofrequency devices. And there is a cooling system. This is the blue circle, as you can see here. This is to ablate the intima, to protect the intima from any injuries, in comparison to the 4 hemisphere ablation from the radiofrequency system. For the ultrasound devices, it comes in a different sizes, in the different balloon sizes. So I use IVUS. Usually I found it very useful to use IVUS, as you can see here, just to measure the diameter accurately. But also fluoroscopy can be done if you want. But for myself, in my experience, I found IVUS is very useful to size the renal artery and pick up the balloon that you need. This is the procedure in a short. Again, aortography, selective angiography for the renal arteries, and you go to ablate only the main renal artery. We don't have to go for the branches. You ablate any main arteries between 3 to 8 millimeter in diameter, no branches for ultrasound. This is the only head-to-head trial between the devices, the radiofrequency versus the ultrasound. It's called the radiosound trial or study. It compares the radiofrequency or RF in the main renal artery only versus the RF in the main antibranches versus the ultrasound in the main artery only. And the result showing that the weakest ablation and the results, it's with RF in the main. And when we do the contemporary ablation with the RF in the main and the branches, it's equal to the ablation with ultrasound renal denervation. So for the RF main and the branches, for ultrasound only main, and this is equal. RF in the only main, this is very weak and we don't do it. This is to compare, a table to compare between the two devices, RF and ultrasound. Both are femoral approach, 6 French rapid exchange system for RF, and it's over the wire balloon, 7 French for the ultrasound system. It's one catheter only in the RF, one size fits all. It's several different balloon size for the ultrasound, so sizing is important. We ablate again main and branches for the RF in comparison to we ablate only the main renal artery for the ultrasound. And the key differences between the both devices is the time. It's 11 minutes ablation versus only 42 seconds for the ultrasound, because the ablation is only 7 seconds for the ultrasound. So this is the key differences between the both devices. So we are not comparing F-16 versus a kite, but rather I think we are comparing something like Apple phones versus a Samsung. Both have a good options and good software, but with the different features between the devices. And there is, just to choose a good patient and a responsive patient, we have a certain indication suggests a better responsive to the ablation. The younger the age of the patient at the presentation, the more favorable results we expect. And the better response is expected also with the higher blood pressure at the presentation, and the effect is consistent between males and females. There is no difference between both sex. What about the safety? Actually, both devices are really safe. There is no any effect on the renal function. There is no renal artery stenosis, for example, or dissection. This because these complications are extremely rare in the studies. And complications are mostly related to the vascular access. So be sure that you have a clean access under ultrasound guided. So this will minimize your complication to almost to zero. This is, if we want to compare between the medical therapy versus the renal denervation, it's clear tolerability and adherence goes with the renal denervation. Both are effective renal denervation, medical therapy, both are effective. Safety, both are safe also. Durability, it's clearly related to the dependence and adherence of the patient to his medical therapy. If he's taking medical therapy, so it's durable. If he stopped his medication, so it's not durable. In comparison to renal denervation, once he did the ablation, it's durable. Cost, I think it goes with the renal denervation. Patient preferences also makes a role. So we have coronary artery disease, we have peripheral vascular disease, mortality, stroke, heart failure. This is a well-known disease, holds much comorbidities and complication, and all this disease, the reason is well known and the cause is hypertension, so it's better to treat the cause rather than treat the complications to minimize patients' outcome or to improve patients' outcome. So in conclusion, we have two devices which approved. Both have a very efficacy and safety data with a different procedure characteristics. So you have to make your own choice. I have my own choice which device to choose and to work with my patients. You have to pick whatever you want and just go from there. Thank you very much.